Okay, Dr. Maya Kinzigler of Monarch Family Chiropractic. Welcome to our workshop tonight. We are talking about headaches and migraines and really understanding why they matter to our health. And I just want to take a moment to really pause and appreciate you who are showing up to be a part of this workshop. Not many people are committing to a Tuesday night for 30 minutes to learning and educating themselves. Frankly, when you look at the stats of how many books are read after school, right, after we graduate school, it's really very minimal. And so people aren't really spending a lot of time to educate themselves, especially when it comes to health. And as the saying goes, an ounce of prevention is worth a pound of cure. And unfortunately, too many of our our American counterparts are really in that healthcare model where they are to the point where they need more aggressive care because they've reached that point of, intervention. And so my hope with the conversation tonight, especially around headaches and migraines, that it gives you a different lens and tools to help address if you do have a migraine or a headache. So let's get started. Let's see. Okay, so I think the first thing is really defining what headaches. So headaches are the most common form of pain, and it is a major reason cited for days missed at work or school, as well as visits to the doctor. And I want you to understand, a lot of people think chronic needs to be like lasting years. But when you look at the definition of chronicity, it's categorized as something that lasts 3 months or longer. So if you've had anything that is in the time frame of 3 months, you are considered a chronic case with whatever condition you want to give that label to, if it's low back pain, if it's headache, migraine, whatever that may be. And so really understanding what is a headache. And I want you to think about it in terms of energy. It is an energy crisis to the brain, whether it's neurological in nature, so our brain nervous system, or it's vascular in nature, so the blood that moves to and from the brain. It's really how our brain is fed appropriate information. And if we have a headache, it's indicating that the energy the head is receiving is inappropriate or stressed. So it literally is a stressed brain. And I just want to pause here for a moment because I have people who come into the office saying, oh, I don't get headaches that much, maybe once or twice a week or weekly. And once or twice a week is pretty substantial. I mean, once is 52 headaches in a year, right? You get anything more than that, it's doubling that. So it's pretty big deal. And as we dive into some of the research that I'm going to show you, it's a big deal to be experiencing headaches. In our culture, we're so used to popping, over-the-counter meds for any pain or symptom that we experience that I think it's become normalized, but it's certainly not normal. It's common, but not normal. So understand, if you're having a headache, it is a stressed brain. And it's always important to be curious around the symptoms that you're experiencing, not just, oh, I've got a headache, give me something to get rid of it. Why do you have a headache? Why is your brain stressed? And if your brain cells are an energy crisis, it could lead to a degenerative stress to the brain. And who wants degenerative stress to the brain? Anyone? No, nobody wants that. So I've done the headaches and migraine workshop previously, and I've gone into detail about the different types of headaches, gone into different stressors to the brain, and I wanted to give a little bit different lens today. So I really want to focus on the physical aspect of what may contribute to a headache. And I want you to think about headache in terms of intracranial, so coming from the inside out, and then extracranial coming from the outside in terms of how the brain is stressed, giving us a headache. And so if we're talking about intracranial headaches, that typically is categorized as a migraine. And when you get a migraine, usually it's one side of the head, it's coupled with some vision changes, maybe increased sensitivity to sound and light. I mean, typically if somebody has a migraine, the way that they, can help address the pain is they have to shut themselves in a room, close the door, turn the lights off, and have zero input. And this is how sensitive an intracranial headache can be, or migraine can be. So really think about it. If you got if you see that brain there, this is coming from the inside. And there's three components that we look at in terms of stress: physical, chemical, emotional. Again, I'm focusing on the physical component tonight. Understand there are others, but the physical component, so it could be dysfunction in the brainstem due to an injury or past illness. Okay, dysfunction of the brainstem from an injury could be something as simple as a motor vehicle accident, right? If we had a sprain, strain, or whiplash type accident, that could cause injury, and if not addressed, illness down the road. Certainly eye strain. I mean, I know anybody who is working on a computer long-term, really getting in close, reading those really small graphics or symbols, and staying in that posture, that position, that can be a cause of an intracranial headache or a migraine. Poor posture. We're going to get into how poor posture certainly can stress not only the spine, but the brain. But if we've got postural distortions, right? If we've got what's called anterior head carriage or forward head carriage, right? If we're here, it puts a lot more stress on a spine and ultimately the brainstem. My hope is when we dive into some of these pictures tonight, you're going to just do a little observation of your environment tonight or tomorrow. And you can start to pick out any postural or disturbances or poor posture, and then maybe even get an idea of if that person has a stress brain and ultimately a headache or a migraine. Other health conditions that affect the neck or spine can contribute to intracranial headaches or migraines, including your TMJ, your temporal mandibular joint. Everyone has a TMJ. So somebody says, oh, I have TMJ. Yes, you do. You have TMJ on both sides. So if you have subluxation of your TMJ, if you have restriction or injury to your TMJ, that can contribute to stress to your brain. And then if there are high levels of inflammation, which affect the nerves in the brain and the blood vessels, again, thinking about stressed brain as a result of neurological or vasculature that are impeded upon or stressed. Now, I want to pull out a couple studies. Why does it matter if you get a migraine? This is from Harvard Medical School. Migraines may permanently change your brain structure. And this is what it was titled, Migraines. Can dementia, stroke, or heart attack be next if you suffer from migraines? So after increased blood pressure, migraine with aura was the second strongest single contribution to risk of heart attacks and strokes. That's pretty significant. And understand, this doesn't happen overnight. This happens after years and decades of not addressing why there's a neurological or a vascular component to you having a migraine, and just taking your Tylenol or taking your over-the-counter meds, to alleviate that pain. And again, the results showed that migraine with aura increased the risk of white matter brain lesions by 68%. And migraines with no aura increased the risk by 34%. Still pretty significant compared to those without migraine. Now, the risk for infarct-like abnormalities increased by 44% with migraines with aura compared to without. So infarct-like is a mini stroke. And so again, why does it matter? If you have a stressed brain, that's putting you on a trajectory of chronic disease down the road, right? And if anyone has a family member who's got dementia or who has had a heart attack or a stroke, and the care and treatment that's needed to address that long term, and then we talk about the quality of life for that person, it's a big deal. So really talking about this conversation now is the time. And then how can you address it more appropriately? So I find that to be pretty disturbing and concerning. This came out of the Multiple Sclerosis Journal, and it was a massive study. And they found increased risk of multiple sclerosis among women with migraines in nurses, 68,000 women. So if you have a history of migraines, that's associated with increased risk of MS. And what is MS? MS is the label of lesions in your brain and brainstem. And a lesion, what is a lesion? It's just a portion of your brain that doesn't match its surrounding areas. So it could be deadened tissue, it could be actually plaquing or deposits of things, but MS is certainly a neurodegenerative disease, crippling, long-term. I mean, these folks are looking at life in wheelchairs, right? So if you have a history of migraines, there is potential for or could lead to chronic degenerative problems. Again, what's a migraine or a headache? It's an energy crisis to the brain, meaning the brain is under stress. And if the brain is under stress for years and decades, boom. Here we're talking about MS, strokes, heart attacks, those sorts of things. Go back. Dementia, strokes, heart attacks. Okay. Now let's talk about headaches in terms of extracranial, so outside of your head. And typically this is a tension type headache. So it can be dull, aching head, sometimes a head strap. So there's pressure and tightness around the forehead, and it's muscle aches and pains on the side and the back of the head. It can include the neck, can be sensitivity to sounds. And these can be episodic. They can occur fewer than 15 days per month, lasting 30 minutes to a few hours. They can be chronic, lasting several hours and more continuous. And so again, different mechanism in terms of where the headache is coming from, and yet it can still have certainly major impacts to creating a stressed brain. And so what are the physical components of creating more tension, extra type cranial headaches? TMJ. A lot of times, and Dr. Chris and I have talked about this, is when we're adjusting, so when we're assessing the cervical spine, especially these upper cervical spines, C1 and 2, we find that a lot of times people with headaches, they have subluxation right in the upper cervical spine, and even the occiput, so how the head sits on the spine. So you've got lots of muscle tissue around here, your suboccipitals, your scalene muscles, your SCM, and then you have these smaller muscles that attach from vertebra to vertebra, vertebra to occiput. And we find that sometimes, I mean, you can have spasm and tightness within your suboccipitals. And a lot of times you guys, when you have headaches, you're like, oh yeah, it does feel good to just put pressure through the back of my occiput. Sometimes we see cranial, so how your cranial bones are moving or how they're aligned. And then we see TMJ associated with it too. Sometimes we have to go inside the mouth to address some of the ropey and rigidity that holds that jaw in place. And when we do that, we go back to feeling what's going on through this upper cervical spine. And it's like the muscles are just and happy, like, ah. If I were to give it a sound. So a lot of times if there's any TMJ restriction, malalignment, subluxation, that can contribute to you experiencing headaches that are more extracranial tension. And bruxism, I mean, that's grinding of the teeth at night, clenching your jaw, sleep apnea, constantly being awakened. I mean, certainly if you're not getting appropriate sleep at night, that's when you regenerate. Your body heals, so that's a whole nother component. Physical stressors to an extracranial headache, prolonged sitting, lack of movement, postural distortion, I already talked about too little sleep. But let's go back to prolonged sitting, lack of movement, postural distortions. Really these first 3 bullet points is where chiropractic fits in as far as the physical stressor, and how we help address healthy movement within the spine, healthy input into the brain, which helps you better process your world, take stress off the brain, literally. But then we can turn on those postural centers within the brain, so the brain starts changing how you carry yourself, which is pretty cool. But again, if you are going into a workstation setup where you are training your body to be in for 6, 8, 10, 12 hours a day in front of a computer, that is intense training. That's intense. So you think about, well, what's the training I have to do to counteract that stress that pulls me forward? You have to be intense about it. And so that is why, I mean, we've always done in our entire existence of being a human and being, upright and bipedal, is we've all lived in this world of, in front of us, but we've been much more active in using our body, as we've evolved. And now we are so chained to our desks and so sedentary, and everything we do in terms of entertainment and how we enjoy social activities, we find ourselves sitting or on technology. And so this is where it can be really, really challenging and creating a stressed brain over the long term, because everything in our world is so tied to that posture. And so in terms of the physical component of the intracranial and extracranial stress headaches, these first 3 are really where chiropractic shines. Again, I mentioned too little sleep. Women tend to have a higher tendency or be at higher risk for experiencing headaches. And then if you are middle-aged, that also tends to be a higher risk group. And while anyone can suffer from a headache, typically we find that when you hit 30s and 40s, it seems to be people's peak. Hold on, let me read that. There's evidence that tension headaches seem to peak when people are in their 30s or 40s. Okay, so excuse me, when you're in 30 or 40, it's where it peaks. And I think that could possibly be due to growing stress levels and then reduced levels of physical activity and movement. So it's kind of not a great coupling in terms of where we are life-wise and activities we're doing there. So think about headaches in terms of, is it coming from the inside or outside? And if you're having a headache, know that it is a stressed brain. And so we want to look at structurally, physically, what's going on there. Okay. So I wanted to just take a couple x-rays and postural pictures here, because I just want you to see how common you can have a postural distortion and how that shows up in terms of your structure. And then we think of it on a deeper level in terms of how does that relate to the brain? Because this is my challenge to you. When you are outside or in a social setting or around other people, I want you to assess their posture, because their head, their ear, actually that hole in their ear should line up perfectly with the middle of the shoulder. And so this is actually a postural picture, and this is this person's x-ray side by side. So I want you to see, sometimes when you look at posture, it is a window into the brain. So when you have this level of forward movement, we call that anterior head carriage. And so you have not only a change of the curve, but you're seeing where that person's weight is distributed through their head. But I want you to see this curve here. That curve, if you're looking at the x-ray, that's where this person's spine should be. Should have a nice banana neck as a curve. And that C1, you see those 2 red dots there? That's making up an angle. So this angle here says it's 10 degrees. That's a 10-degree angle. Normal angle for your C1 should be between 28 and 32 degrees. So you can see that that's really leveled out with that forward head carriage. And I want you to think about this. Yes, that's not great for structure, not great for the tissues that hold that head in place, right? These guys are back here working hard to maintain upright posture as we're moving forward. These guys get tighter up through the front of the muscle, through here. And now we're seeing that the structure is not just the tissue that's impacted, the structure has changed. So a lot of people just say, well, I want to get my massages, which feel great. Yes, they do. I agree. And yet, if you're not changing the structure, your muscles and the soft tissue are always going to go back to where the structure is. So you've got to change the structure. And when you change the structure, you change the tension and tone on a nervous system and how that brain is stressed, and you change the whole thing, which is great. And yet, you know, it's easy to talk about structure, but I want you to know that we see amazing changes when you're just getting adjusted. When you're just removing the stress between the brain and the body, turning on those postural centers, and the brain starts responding differently. You start carrying yourself differently. So we can see the brain make that change. And because you're doing so much of the other things outside of getting adjusted that are ramping up on intensity to lead to this type of presentation, you need more most of the time. I would say 99.9% of the time. We can get some changes, but ultimately to improve this, it takes more work. Here's another example. Again, thinking about headache as an energy crisis to the brain. It could be a neurological component, could be a vascular component. And I just want you to think about, how is this person's posture contributing to stress to a cardiovascular system, stress to a neurological system, stress to the brain, stress to the heart. Because we have seen, there's some cool research out there showing an adjustment to C1, first vertebra on your spine, has actually lowered your blood pressure by 20 points and maintained that for 6 weeks. That's a big deal. And so when you've got somebody who should have a banana curve there, right? You follow that white line, that's where that curve should be. This person not only has a straightened curve, but they've got a reversal. That's concerning. And again, going back to this person actually has headaches, regular headaches. And when the demands in her world go up, she has more stress, boom, headaches come on, and they're really challenging to address. And you see, she's actually got a reversed curve. That's concerning, because I'm looking at this person, not just now and in the moment, how she's doing, but I'm thinking about, what's her life look like 20 years from now? Is she on the trajectory to, be a stroke or dementia candidate, right? This is a stressed brain. This is a stressed system. This has got to be addressed. She's in her mid-20s. She doesn't do anything about this. It means life is different for her in 20 years. That's a big deal. We see this all the time. This is somebody who's a little older. They're in their late 50s. Again, please just observe your fellow human beings that are around you and just check in with their posture, because majority of us are walking around with stress brains. It's, what is the degree of stress that we are experiencing? So this guy, he got his x-rays outside of our office, so I don't have the lines there. But he's, again, pretty straight curve. Look what's happening. Look at the front of his cervical spine. See how these bones are no longer individual? His spine is actually fusing together, create a more stable internal environment, where you put compressive forces down. There's been stress put on a spine. Your body and brain want to go in and create a natural fusion so that you can maintain some level of stability. So again, we want to make sure that this spine is getting appropriate input and movement. We can't change that he's fused, but we can change the compressive forces of how the gravity is working on him, how his body is working on him, so that he has less stress to the brain. Right? So you think about those two people that we had seen or looked at earlier, right? Mid-20s, early 30s. And again, what does 20, 30 years look like on that spine if it's not addressed? This we are seeing all the time. So my last question for you, because let's look at the time, 6:13. What do most people do when they have headaches? Tylenol, most people. Some turn to ibuprofen, Motrin, and NSAID, a non-steroidal anti-inflammatory. What should most people do for headaches? I would say what most people should do for headaches is say, what's going on? What am I doing? What's my body telling me? Right? So maybe we start with, again, think about neurological components, think about vascular components. That's a headache. So if we hydrate, what's that doing? That's actually changing and hydrating our cardiovascular system. Our body is made up of 75% water, right? We give it water, everything dilates, we have more flow and more ease. And guess what happens? When we're dehydrated, our body will pull from areas of hydration. So guess where in the spine you have high areas of hydration? Your discs. And so if you're dehydrated, you may experience headaches, and that impacts your discs, which impacts your structure. And if you've got already poor posture, it's just mounting on top of each other. You see, it's like multiple demands on a body that contribute to how you're expressing your health in the moment. Electrolytes. So is the water that you're drinking actually being absorbed in your body? I mean, some people say, man, I'm thirsty all the time. I just keep drinking water, 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 water. Can't get enough water. And the question is, well, are you actually absorbing that water? So maybe add some salt to the water, or maybe add some fruit to the water. I don't love Gatorade. I don't love Powerade. Outside of a blueberry, what in the world is like natural about bright blue liquid? So I mean, that's where I like to naturally support the water with electrolytes through food, whether it's fruit or something like that, or drinking some people will take like a can of pineapple and then just drink the juice, or watermelon, just drink the juice from the watermelon. Improving your posture, doing some neck mobility or stretches, assessing your workstation ergonomics, or maybe you just need to go for a walk, take a breath, get some sunshine, fresh air. That's what most people should do for their headaches. And most people say, oh, I need to get something in, I need to get this pain away so I can get back to what I'm doing, which is already creating this vicious cycle of stress to a brain. And we didn't even go over those mental, emotional stresses, those chemical stressors. They're there too. And that's how amazing your body is, because you are exposed to so many stresses all day long. And it just continues to get more and more and more and more. Doesn't change. It does change, but how you adapt to it, you want to be able to meet that demand. So I hope that this gave you clarity, or maybe a different lens in terms of how you experience your body, specifically what may be going on in your head, physically, structurally. Because what you do today and the choices you make today and what you do consistently every day is putting you on a trajectory of health, and literally can change what you are going to experience, the expression of health for you in 20, 30 years. And I'll go back to this slide. I mean, who do you know who looks like this? Should be everybody. I mean, I would love for you to assess everybody in your family tonight. If they've got a forward head posture, their brain is under stress. That means that if a brain is under stress, they're not able to adapt properly to their world, and they're not being their best self, whether it's for themselves for their family, in work life, whatever it may be. And if they have that posture, they need to get assessed by a chiropractor, period. No questions asked. So this is my call to action to you. Who do you know that needs to know this information, that either one, you can share this presentation with them, and number two, you can bring to the office or bring to the next workshop so they can understand how important it is to take care of your spine and your brain. Because the worst thing I can hear is, nobody told me. Nobody told me this. Why didn't they tell me this? And they're 20, 30, 40 years into degenerative changes that are certainly probably causing stress to the brain in other ways we maybe aren't measuring. So that's my call to action to you. And I appreciate you. Thank you for being here. If you have questions, I'm going to stop the recording. I'm happy to take questions. But again, Dr. Maya Kinzigler, Monarch Family Chiropractic, and we'll see you in the office next time.